Hello, my name is Dr. Sujat Pathan, and I'll be presenting today some tips related to MRCEM examination part A. The MRCEM examination is the membership examination which is conducted by the Royal College of Emergency Medicine in the UK. The exam is conducted throughout the year. Part A is conducted in India, Oman, Singapore, and UK. Part B and C are conducted twice a year in India and in UK. You visit the RCEM website for eligibility and other details and obtain a copy of curriculum. Part A basically deals with basic sciences related to emergency medicine. So they don't want us to know every bits and pieces of basic sciences, but they want us to know those principles or concepts that we can apply in our day-to-day practice in the Department of Emergency Medicine. Part A contains 50 question stems with 4 sub-questions. So total there are 200 true or false questions to be answered in 2 hours. People usually don't like basic sciences. If you think that the knowledge of the the way we l- learned basic sciences in our medical school was entirely different. Uh, how to make it easier? How do we? People will be thinking like how to retain the concepts or retain the knowledge of basic sciences. That's many of us cannot remember it because we have not been studying it in that particular way how it should be studied. Uh, I think if you can apply the knowledge of basic sciences at the bedside and correlate it clinically, then you would love it. Let me give you an example. How many of us do remember Laplace's law, Puzel's law, Dalton's law, Ohm's law, or Virchow's triad? Of course, most of us will think of these things being taught in physics much earlier than we entered medical school, or for some of us, it was taught in pre-med. Let me give you an example about Puzel's law. The Puzel's law states that the rate of flow of fluid is directly proportional to 4 times the radius and is inversely proportional to the length of the tube. How do we apply it clinically? Clinically, you apply it, for example, whether fluid can be given faster through a peripheral line versus a central line. How long is the cannula of the central line and the peripheral line? The cannula of central line is longer, so uh, the flow of fluid will be inversely proportional to the length of the tube. So flow will be much slower in central line versus the peripheral line. The second thing is about the gauge of cannula. Flow of fluid will be faster in a smaller gauge. For example, flow will be faster in an 18 gauge cannula than a 20 gauge. So that's why we, in shock states, we tell our nurses, we recommend putting a very small gauge cannula. Most of us would like to start with either a 16 gauge or a 18 gauge to push in fluid faster. And you got to think why the college want us to know this, because we will be applying it in daily practice. We will be applying it at bedside to cure someone, to relieve somebody's pain, right? So that's the reason. I would like to put in a disclaimer over here. All of my videos will not cover everything in the curriculum, but I would take it this way. I would not go to the exam without knowing at least these facts, which will be covered in the various videos following and the various videos which I have uploaded earlier. Secondly, I'll be using some mnemonics uh, to remember stuff. I'm not gender biased or race biased or uh, biased by any means. My mnemonics may contain some X-rated words, so just kind of I'm pre warning you or something like that. So it's just so that those things are just made for us to remember some important stuff which we have to remember. So I may make up stories, so based on a male versus a female or something like that. But those are just stories to make it easier for us to retain these concepts. I'll be putting up some flowcharts or some diagrams which I have taken from USMLE material, especially most of it are from first aid for USMLE step 1. So a lot of credit goes to the authors who have created those mnemonics and pictures. Let me tell you about the exam taking skills. No doubt you need to work hard, you need to do rigorous study for 4 to 6 months. The books which are commonly recommended uh, are Mark Harrison revision notes, and there is one more by Ian Birdsell, The Question Bank. uh, be focused on your goals. Remember, you need to take your exam, so you decide when do you take it, when are you going to take part A, when are you going to take part B. So be planned, be focused, so that you don't miss the deadlines and everything. Use the online question banks. There are, I think, 3 or 4 available online. I would not comment on which one is better than the other, because all of them contains around 1500 to 2000 questions, and the more questions you solve, the better it is. I would, if I have the opportunity and the resources, I would do 2 or 3 question banks. uh, if not, at least one question bank before I go to the exam. Remember, you need to obtain 70% to pass this exam. So anybody who don't know anything about medicine just goes there, he has a probability of getting 50% score. So we need to work for the additional 20% only. You don't need to get 100% marks for passing. You just need 70%. So you push yourself hard, but just remember this thing, that you're going to work for that 20% which will decide between you pass or fail. One important thing for part A, B, and C is you got to read the questions properly. They may put in words like accept, always, uh, can, may. So just be careful what they are asking us. They might, in anatomy, like they might put in teres major instead of minor for rotator cuff. So just be careful while you read the questions. In general, always and never is mostly false. May is mostly true, because in medicine nothing is 100%. So it may be possible. And remember, one more thing is attempt all questions. There are no negative marking. So in case if you're falling short by time, just make your wild guess. Attempt all of them. Uh, Attempt all. This is very important. The marks distribution, they have placed a lot of emphasis on anatomy and physiology, and they are asking almost 40% from these two things. So spend your time wisely on anatomy and physiology. Make diagrams by yourself, make mnemonics by yourself, how to remember these stuff. Then comes pharmacology, microbiology, clinical biochemistry, and hematology, 10% each. Pathology and statistics are another 5% in total. Don't waste too much of your time on learning statistics. Try to learn the most important concepts, because just 2 questions will be asked, and they would like to test which is very commonly seen, rather than testing some difficult stuff. Some extra tips I would like to give you. Uh, some interesting things are this article, How to Fail the MChem Part A. This is written by some good doctors in emergency practice in India, and they have mentioned very good important tips. I would just download it from this link and try to read it before I start my studies, or whenever I find time. Read the recommended study plan, which I have put it on my blog, and there's the link. Day before the exam, I would reach the city where the exam center I have selected. For example, if I have selected Hyderabad or Chennai or Delhi, I would like to go there at least a day or two before, so that I'm acquainted with the weather, with the traffic, with everything. And I also know how far I am staying from the center, so I would like to pay a visit to the exam center a day before to see how much time I'll take to come. A day before the exam, don't stress too much, relax, have good night sleep, 8 to 10 hours. 8 hours I would recommend strongly. In India, basically the exam is held in the afternoon time because exam all over all over the world happens at the same time as in the UK. So the exam in UK will begin at around, consider, 9 or 10. So accordingly, it will begin in India around 1:30. So have a full breakfast in the morning. Don't skip it and don't be anxious. Uh, I would not have a full lunch before I go to the exam because it will just make you more dizzy, drowsy and sleepy. Maybe I'll eat something lighter like a sandwich or something, have some coffee. I'll keep some chocolates to provide the required glucose for the brains to function. And once you're done with the exam, just chill out and enjoy because you can't change anything after that. So just relax, enjoy, see the city, move around, party. So just don't stress too much after the exam. During the exam, I told you before the exam and after the exam. I didn't tell you during the exam. Here are a few things which I would consider, and these points have actually worked well. So take few deep breaths to relax yourself before you begin the exam. How do you solve the exam? Uh, there's a saying called "How do you eat an elephant?" In bits and pieces. How do you win a test match? You win session by session. You don't play it thinking, "Oh, I'm gonna win the match over 5 days." You play it session by session, win each session. So what I do is I use this thing. I consider our concentration level at the beginning of the exam is at 100%. And as we go solving questions, we tend to lose focus a bit, or in the flow of things, our concentration level falls down gradually. So this is the thing which this strategy I used during my examination and it worked well. Many of my students have used and it worked well for them. What I do is I tell myself I'm going to concentrate on next 5 questions and I'm not going to get any of them wrong. So I bring up my confidence to 100%. I bring up my concentration to 100%. And I tell it to myself that, okay, 5 questions now. So I solve the 5 questions. Once I reach the sixth one, I again tell the same stuff. Okay, now I'm going to concentrate on my next 5 questions. I don't care about the remaining 45, remaining 40. So I try to do that, and then my concentration levels are in kind of a flutter pattern. Goes down up to fifth, and then suddenly comes up, and then goes down up to 10th, then comes up 11th. I'm 100% again. So in this way, and you can try this method by when you're solving the mock exam. So you will know whether it works for you or not. Keep a track on time when you're using this method. Always keep a track on time. As I said before, answer all your questions, answer all the questions, give your best guess and move ahead. Don't waste time on one or the other question. Don't get stuck up. In anatomy, if I got stuck up, I used to feel for that particular part on my leg or on my hand and then think, okay, yeah, this is it and this is it. Common flexor origin, is it laterally or medially? So I used to just flex my uh, wrist and see. So this is the way I used to do. Do not waste your time in peeking in what others are writing or trying to ask somebody. This is counted as cheating. Even if you tend to pass that way, it's not going to benefit you in the long run. It's not going to benefit your patients. You will always have that guilt that you passed the exam by using unfair means, and that's not good. So spend time wisely rather than peeking in. Okay, that person wrote B false, and I think it is. I'll change my answer to false. Don't copy. Don't waste time on all that stuff. And work hard, be focused, and good luck. You can do it, and it's easy. It's not a difficult exam. Tell yourself that it's not difficult. You have done it in the past. You have come a long way. You will do well in the exam. Good luck and work hard. Practice. See you later.